Welcome to today's video about early signs of heart failure. What if the shortness of breath you felt climbing a single flight of stairs wasn't just age catching up with you? What if that nagging nighttime cough or the swelling in your ankles wasn't something you could shrug off as just getting older? Here's the shocking truth every single day. Your body is sending you signals subtle, silent, but urgent that your heart may be failing, and ignoring them could cost you your life. In the United States alone, more than 6 million people are currently living with heart failure. That's more than the entire population of Los Angeles. Even more alarming, research shows that most of them didn't recognize the early signs until it was dangerously late. Why? Because the early symptoms don't look like a dramatic medical crisis. They look like everyday annoyances: being tired, needing more pillows at night, or gaining a few pounds quickly. But beneath the surface, your heart could already be struggling, gasping for strength. This isn't just about statistics. This is about you, your family, and the everyday moments you don't want to lose. Imagine missing out on playing with your grandkids, walking around the block with your spouse, or even enjoying a peaceful night's sleep, all because the warning signs slipped past unnoticed. The fear isn't just heart failure itself. The fear is not knowing it's happening until it's too late. That's why in today's video, we're going to break down 13 early warning signs of heart failure that most people completely overlook. Some of them will surprise you, like why needing extra pillows at night can reveal a struggling heart, or how tying your shoes could expose a hidden danger. By the end of this video, you'll know exactly what to watch for, what's normal, and what should send you straight to your doctor. Don't ignore this. Don't scroll away. Your body might already be whispering these signals, and catching them early could literally save your life. The very first sign you must pay attention to is shortness of breath during simple activity. Imagine this. You are climbing a single flight of stairs you used to handle with ease, or just walking to the mailbox. Suddenly, you find yourself stopping halfway, chest tight, lungs straining, telling yourself it is just age catching up. This is not normal aging. Here is the science. When your heart muscle weakens, it cannot pump enough oxygen-rich blood to your muscles. Your lungs try to compensate, forcing you to breathe harder and faster, even during light tasks. According to the American Heart Association, exertional shortness of breath is one of the earliest and most common signs of heart failure, and research shows it can appear months before other obvious symptoms. What can you do? Do not ignore it. Start by noting when it happens, how long it lasts, and whether it is getting worse. A simple health log can become a powerful tool for your doctor and may catch the problem before it becomes life-threatening. But just knowing this one sign is not enough, because there is another hidden signal that shows up silently while you sleep. And it is even more dangerous. After breathlessness with effort, the next red flag often shows itself at night. You may notice that lying flat in bed feels uncomfortable. One pillow used to be enough, but now you find yourself stacking 2 or 3 just to breathe easily, or even choosing to sleep upright in a chair. Many dismiss this as a preference or simply aging, but it can be a direct signal from your heart. Here is what happens inside your body. When you lie flat, gravity no longer helps return blood from your legs to your heart. If the heart is weakened, blood backs up into the veins of your lungs. Fluid begins to leak into lung tissue, making each breath harder. This condition, called orthopnea, is not rare. Studies from leading cardiology centers report that nearly 80% of patients with heart failure experience it. What makes it especially dangerous is how gradually it develops, so slowly that people think it is just comfort. The solution is awareness. If you notice that you have gone from sleeping flat to needing extra pillows or even sitting upright just to breathe, it is time to pay attention. Keep track of changes in your sleeping position and breathing comfort, and bring this up with your doctor. But only recognizing this pattern is not enough, because there is another warning sign that does not wait until morning. It jolts you awake in the middle of the night, and it can be terrifying. From needing more pillows to breathe comfortably, the next warning sign is even more alarming because it does not wait until morning. Imagine this. You are asleep. Then suddenly you jolt awake, gasping for air, heart racing, feeling as if you are drowning in your own bed. Many people brush it off as a nightmare, anxiety, or even sleep apnea. In reality, this terrifying episode is called paroxysmal nocturnal dyspnea, and it is a serious signal of heart failure. Here is the science. During the day, fluid often collects in the legs. When you lie down for several hours, that fluid redistributes back into circulation and reaches your lungs. A weakened heart cannot handle the sudden increase, leading to acute shortness of breath that shocks you awake. Clinical studies show these episodes usually happen 2 to 4 hours after falling asleep and are one of the most frightening early signs of heart failure. Patients often report rushing to an open window or standing up in desperation to breathe again. So, what can you do if you wake up more than once struggling to catch your breath? Do not ignore it. Track the frequency of these episodes and consult a physician immediately. This pattern, especially if it repeats, is not just stress or bad dreams, but just recognizing this nighttime signal is not enough, because the next warning hides in plain sight during the day, draining your energy and stealing the joy from even the simplest activities. After those frightening nights of waking up breathless, another sign shows itself quietly during the day. It is not dramatic, but it steals your energy and your joy. You wake up after a full night of sleep, yet even simple tasks like showering, cooking, or carrying groceries feel overwhelming. You tell yourself it is just getting older, but this is not ordinary tiredness. This is fatigue driven by a struggling heart. Here is what happens inside your body. When the heart cannot pump effectively, it diverts blood flow away from less critical areas, sending most of it to the brain and vital organs. That means your muscles receive less oxygen-rich blood. The result is a crushing exhaustion that does not improve with rest. According to medical studies, this loss of stamina can appear months before more obvious signs like swelling or chest pain. Many patients unknowingly adjust, avoiding activities, resting more, and blaming it on age, while the underlying problem worsens. What can you do? Pay attention to patterns. If daily activities that once energized you now leave you wiped out, note it down. Keep track of how long it takes to recover after small tasks. Share these details with your doctor because they can reveal heart failure earlier than any lab test. But noticing fatigue alone is not enough, because sometimes the most visible clue is not how you feel inside, but what you can actually see happening to your body from the outside, from hidden fatigue that drains you inside. The next warning sign shows itself clearly on the outside. You glance down at your feet at the end of the day and notice your socks leaving deep marks, your shoes feeling tighter than they used to. This is not just about standing too long. It can be one of the most visible early signals that your heart is struggling. Here is why. When your heart cannot pump blood efficiently, circulation slows, blood begins to pool in your lower body, and your kidneys react by holding on to more salt and water. The result is swelling in the feet, ankles, and sometimes the legs. This condition, known as peripheral edema, is not rare. Studies published in major cardiology journals reveal that around 70% of patients diagnosed with heart failure present with this swelling. It often worsens throughout the day and affects both legs equally. What can you do? Do not dismiss swelling as simply water weight or aging. Press gently on the swollen area with your finger. If the indentation stays for several seconds, it is time to take it seriously. Record when it happens and how severe it is. Then bring this evidence to your healthcare provider. But noticing swelling is only part of the story, because there is another clue that does not just show on your body, it shows right on the scale, and it can rise alarmingly fast. After visible swelling in the ankles, there is another sign that is even easier to measure and often more alarming. Imagine stepping on the scale in the morning and noticing you are 2 or 3 pounds heavier than yesterday, without any big meals or changes in routine. This is not about overeating or a slow metabolism. This is rapid weight gain caused by fluid retention, and it is one of the most measurable early warnings of heart failure. Here is the science. When the heart weakens, it triggers hormonal changes that cause the kidneys to hold on to salt and water. That extra fluid quickly adds weight to your body. Medical guidelines from the American Heart Association emphasize that gaining 2 to 3 pounds in a single day or more than 5 pounds in 1 week should never be ignored. Each kilogram of sudden weight gain represents nearly 1 liter of excess fluid building up inside you. What can you do? Start a simple daily habit. Weigh yourself at the same time each morning, preferably after waking up and before eating. Keep a record of the numbers. If you see a steady upward trend or a sharp jump, contact your healthcare provider immediately. Catching this pattern early can prevent hospitalization and give your doctor a chance to act before the condition escalates. But even this measurable warning is not the whole picture, because another sign shows up quietly at night, sending you back and forth to the bathroom in ways most people never connect to their heart. After sudden weight gain, another signal often puzzles people because it seems unrelated to the heart. You fall asleep, only to wake up 2, 3, or even 4 times during the night to use the bathroom. At first, you blame drinking too much water before bed or simply aging. But this pattern is not normal. It can be one of the earliest hidden signs of heart failure. Here is what happens inside your body. During the day, fluid tends to pool in your legs due to gravity. A weakened heart cannot pump it effectively back into circulation. When you lie down at night, that stored fluid redistributes through your bloodstream and finally reaches your kidneys. Suddenly, they are forced to filter more fluid than usual, and the result is frequent, high-volume urination during the night. Studies published in cardiology journals show that this condition, called nocturia, often appears before other obvious symptoms, such as swelling or chest pain. What can you do? Pay close attention to nighttime patterns. If you are waking up several times to urinate, and each trip produces more urine than usual, start keeping a record. Share this detail with your doctor. It may reveal heart stress early and prevent it from progressing unnoticed. But only knowing about this bathroom signal is not enough, because the next clue can interrupt your sleep in an even more frustrating way. Through a cough that refuses to let you rest, from running to the bathroom at night, the next warning sign comes in the form of a sound that can keep you and your family awake. A dry, nagging cough that appears mostly at night or whenever you lie down flat. You try changing pillows, blaming allergies, or thinking it is just the room temperature. But this type of cough is often your heart sending out a quiet but serious alarm. Here is what really happens. When you lie flat, the fluid that has collected in your body throughout the day redistributes. Some of it can back up into your lungs. Your body responds by trying to cough it out, but there is no real blockage to clear. Medical literature notes that this cough is usually worse in the early hours of the morning and can sometimes bring up white or pink frothy mucus, which signals fluid is present in the lungs. This is not a simple cold. It is a warning sign of fluid overload linked to heart failure. What can you do? Pay attention to the timing and nature of the cough. If it consistently shows up at night, eases when you sit upright, and resists normal allergy or cold remedies, it is time to see a doctor. Recording when it happens and how often can help your physician understand the underlying cause faster. But being aware of this cough still does not complete the picture, because the next red flag can hit suddenly in your chest, making you feel like your own heartbeat is turned against you. After the nighttime cough that robs you of rest, the next warning sign can feel even more unsettling because it comes directly from your chest. You might notice your heart suddenly racing while you are sitting still, skipping beats, or pounding so hard it feels like it is flipping inside your chest. Many people describe it as flutters or thumps that seem to come out of nowhere. These are palpitations, and while they may seem harmless, they can be a critical clue that your heart is struggling. Here is the science. When the heart muscle weakens, it sometimes falls into abnormal rhythms. The most common is atrial fibrillation, a condition strongly linked to heart failure. Research from leading cardiology centers shows that these irregular heartbeats are both a cause and a consequence of heart failure, creating a dangerous cycle that can worsen rapidly if ignored. They often appear more noticeable when you are resting or lying down, and can be accompanied by a feeling of anxiety or unease. What can you do if you experience repeated fluttering, racing, or skipped beats, especially when paired with other symptoms like fatigue, swelling, or shortness of breath? Do not dismiss it as stress or caffeine. Keep a note of when these episodes occur and discuss them with your healthcare provider. Simple monitoring or an electrocardiogram can reveal what is happening inside your heart. But just spotting irregular heartbeats is not enough, because the next sign can strike your head instead of your chest, leaving you dizzy, lightheaded, and sometimes seconds away from fainting. After the unsettling feeling of a racing or fluttering heartbeat, another warning sign can be even more frightening because it affects your head and balance. You stand up quickly or walk across the room, and suddenly the world spins. Your vision blurs, your knees weaken, and for a moment you feel like you might collapse. Many dismiss these dizzy spells as dehydration or simply standing up too fast. But when linked to heart failure, they mean something much more serious. Here is the science. A weakened heart cannot pump enough blood to maintain stable circulation to the brain, especially during position changes or physical exertion. Normally, your body compensates by adjusting blood vessel tone and heart rate. But in heart failure, these adjustments fail. Clinical studies show that fainting or near fainting, known as syncope, occurs in roughly 20% of patients with heart failure and often signals a dangerous drop in cardiac output. What can you do? Do not ignore repeated dizzy episodes, particularly if they appear with other symptoms like palpitations, fatigue, or shortness of breath. Keep track of when they happen during activity, after standing, or even at rest, and share this with your doctor. These details can help reveal hidden heart problems before they lead to a serious emergency. But only recognizing dizziness is not enough, because the next warning sign hides in your stomach, quietly disrupting your appetite and making even small meals feel impossible. After the dizzy spells that leave you unsteady, another sign shows up in a place most people never connect with heart problems: your stomach. You sit down for a meal, but after just a few bites, you feel uncomfortably full. The bloating lingers, your appetite fades, and sometimes you even feel nauseous. Many assume it is indigestion or a minor digestive issue, but in reality, this can be a warning sign of heart failure. Here is the science. When the heart fails to pump effectively, blood flow to the digestive system decreases. At the same time, fluid can accumulate in the abdomen and the liver becomes congested with blood. This combination leads to swelling, pressure, and discomfort in the belly. Research shows that gastrointestinal symptoms are often overlooked by both patients and healthcare providers, even though they may appear early in heart failure. Some patients report a constant sense of fullness or pressure in the upper right side of the abdomen, where the liver is located. What can you do? Do not dismiss ongoing bloating or loss of appetite, especially if it happens alongside other heart-related signs. Keep a record of how often it occurs and how much it affects your eating. Share this information with your doctor, because these digestive changes can be a critical early clue that your heart is under stress. But even this hidden digestive signal is not the end of the story, because the next warning appears in an unexpected position when you simply bend forward and suddenly find yourself out of breath. After the digestive discomfort that takes away your appetite, another surprising sign can show up in the simplest motion of your day. You lean forward to tie your shoes, pick something up from the floor, or bend over a sink, and within seconds you feel short of breath. This is not a normal response to bending. It is a specific red flag known as bendopnea, and it can reveal serious strain on your heart. Here's the science. When you bend forward, the pressure inside your abdomen increases, pressing upward against your diaphragm. This added pressure pushes against your chest cavity. In a healthy person, the heart adapts easily, but if the heart is already struggling with elevated filling pressures, that extra stress quickly triggers shortness of breath. Research first described bendopnea in 2014, and studies show it is present in about 30% of patients with heart failure. Even more concerning, it is strongly associated with more advanced disease and higher mortality risk. What can you do? Pay close attention to your body when bending over. If you consistently feel breathless within 30 seconds of leaning forward, note the frequency and severity. This information can provide your doctor with an important, non-invasive clue about your heart's condition. Do not ignore it or brush it off as being out of shape. But even recognizing this rare and specific signal is still not enough, because the final warning sign can reveal itself in your hands and feet, showing that circulation itself is failing. After noticing shortness of breath, even when bending forward, the final warning sign can appear at the very edges of your body. You may feel your hands and feet are always cold, even when the room is warm, or you notice a bluish tint on your fingertips or lips. Many people think poor circulation in the extremities is just part of aging, but in reality, it can be a critical marker of heart failure. Here is the science. When your heart loses strength, it prioritizes blood flow to your brain and vital organs, pulling circulation away from the skin and extremities. This leaves your hands and feet colder than normal. In some cases, blood pressure measurements reveal another clue called narrow pulse pressure, which means the difference between the top and bottom numbers of your blood pressure is unusually small. Research shows that both cold extremities and narrow pulse pressure can indicate reduced cardiac output and may appear gradually before a major decline. What can you do? Pay attention to consistent patterns. If your hands and feet remain cold even in warm conditions, or if they take far longer than usual to warm up, note the frequency. If combined with other symptoms like fatigue, swelling, or breathlessness, this could be a serious warning that your circulation is compromised. Bringing these details to your doctor can help catch problems early and prevent emergencies. But just knowing these 13 signs is not the end, because the real danger is when several of them combine, sending a louder signal that cannot be ignored. And that is where your next step becomes critical.